Minnesota DFL Senators Liz Bolden and Aaron Murphy stopped by Rochester today to tour senior living facilities and mental health services, an effort to stay up to date on the latest healthcare issues providers face. KIMT News 3's Evan Berg is joining us live from across the street from one of their stops today at Samaritan Bethany. And Evan, what were the big takeaways?
Sananda, a big takeaway today is while these institutions are glad to have legislative support, there's still a lot to do to make sure we have good quality mental health care and senior care here in southeast Minnesota. Here at Bethany Samaritan, staff said state grants and additional funding for the Elderly Waiver Program helped senior citizens who need more support get the help that they need in a way that makes it more sustainable for providers. Staff say additional funding and support is likely needed to encourage new employees to enter the workforce and stay in it at a sustainable wage. It was a sentiment that was echoed at the pair's other stop today, Fernbrook Family Center, which provides mental health support. The agency said that the mental health industry needed more backing to encourage psychology students to pursue a career in mental health care amidst rising demand.
Minnesota does an excellent job of mental health care compared to especially the rest of the Midwest, and despite that, there simply aren't enough people.
The wages of agency staffing, along with how we support the wages of our caregivers, we need funding to do that. And we can't just make dollars appear out of nowhere. So
hearing from folks here was really impactful and useful, to hear what their needs are, what's going well.
In a statement from Minnesota Moore County GOP Chairman Doran Castle, he agreed with some of the statements we heard today that Minnesota's medical assistance programs can be a challenge, both for the organizations that run them and the patients who participate in them. Live in Rochester, Evan Berg, KIMT News 3.
Right, thank you so much, Evan. And another important topic discussed at the event was the upcoming cut to Medicaid payments for mental health facilities, which will happen on January 1st of next year. And although recent laws raised by these payments by 3% for mental health, there will still be an overall drop of about 12%.